Thank you for doing this, Karen. I've known
Course.
you for a number of years, many years, probably over a decade in the
Yes.
operating rooms. And just to get started, could you just tell us your name, what your career is, and how long you've been doing that?
Okay. My name is Karen Selway, and I've been a surgical tech for over 12 years now. I have done almost all of the 12 years at UCI. I did a couple months at Kaiser in between and have done some pickup per diem jobs, but I've been a surgical tech for 12 years.
And then, so when you were in high school, how did you get from high school to becoming a surgical tech? Like, what's the backstory on that?
So out of high school, I went straight to working as a secretary at an office, and I did a lot of administrative work. I was office manager of a pretty big building, meaning I did a lot of the ordering, running the meetings and schedules, and I did that for about 4 years after high school. And I moved back to the Orange County, LA area and came in contact with a friend who told me that they were in school to be a surgical tech. And I had no idea what it was. All I know is she would come and she would say, like, I got to hold a hip today, the actual bone. I helped deliver a baby. And it seemed so fascinating to me that you could be part of the surgery without having to be the surgeon. So growing up, I always thought it's the surgeon and a nurse and anesthesia. And so I asked her what school she was going to. I found out there was a school near my house and I signed up.
Awesome. What, like, how many years of school was it?
So it's back then it was 18 months.
Okay.
So a year and a half. Yeah.
Is it still that way, or is it 2 years? And is it is it a certificate or a license, or kind of how does it work?
I believe now it's 2 years or closer to 2 years. There's no licenses involved, but you can become certified, which I am, which means you are credited through the National Association of Surgical Techs. And it's a way of getting an upper hand on other surgical techs. I know a lot of hospitals require their techs to be certified. UCI does not, but Kaiser and a few others that I know of, in order to work there, you do have to be certified.
Gotcha. And just for, I think a lot of people who will be listening, they won't even know exactly what a surgical tech does. So what, like, generally, what would you say they do?
So this is how I describe it. My kids think I'm a doctor, which I'm not. I would think surgical techs are a critical part of the OR team, especially for the surgeon. So what you do normally is you come in, you look at what cases you have, you make sure that you have all the supplies and instruments ready for the case. Once you establish that everything's there, you start opening everything up, and maybe you know or don't know, but everything has to be sterile in order for us to open up anybody. We don't want anybody to have any infection. So we open everything up in a sterile technique, meaning we open all our supplies, all our instruments, and then the surgical tech will scrub in and set everything up. So it's a very methodical process where you can come in and you always want a certain thing here, a certain thing there, and it makes it easier for you to do your job during the surgery so that you don't have to keep thinking like what it is, where did I put it, where is it? So once you set up, the surgery starts and you are hand in hand with the surgeon, watching them, making sure that, you anticipate what's next. So if they're suturing, they're gonna need scissors, for example, or, retracting, holding back a retractor so that they could have exposure in order to operate. And you are scrubbed in. I like to say, like, at the right hand of the surgeon, because you are an extension of what they need so that they don't lose focus on actually doing the surgery. And then you finish up the surgery and start your next one.
I mean, there's no doubt you guys are a critical part of the surgical team and the surgeon's right-hand person, obviously. And so it sounds like there's also a lot of like communication skills. You have to be able to communicate well with the surgeon and have a good relationship with them.
Yeah, that is definitely critical. You have to, I would say, surgical techs, most surgical techs have very thick skin. You have to know that if things go wrong in a surgery and the surgeon's flustered, they could come off as yelling or angry and not take it personally. Know that the situation, they have to get it under control. Keep your calm, keep your cool. Know that you have to do your job in order to get this patient safely off the table. And you have to be able to communicate with your surgeon so that you know, hey, we're a team here. We're going to talk. I'm going to tell you what I have. Tell me what you need. Make sure we're all on the same page. So yeah, you have a very close relationship with your surgeons as a surgical tech.
Yeah, that absolutely seems the case. And like in terms of procedures you are involved in, it sounds like you really have to be good at maintaining sterile fields, creating sterile fields, keeping things sterile. Is that accurate? And is there other stuff that you would say procedurally wise you do?
Yeah, so there's most surgeries you're going to use the sterile field technique, which means you want everything as clean as possible. Nobody's touching it with their bare hands. You have a gown and gloves, hat, mask, everything's covered, no hair exposed. There are those procedures off and on where sterility is not as important. For example, anything that's through the nose or through the mouth, those are considered non-sterile orifices. So we put gloves on, we still have our hat on, our mask, but we're not gonna gown and glove for those. So there is a variation in what you can do, what's considered sterile and what's not. And even in a sterile case, there could be situations where you have sterile stuff and then you have extremely what we call dirty, which could be cancer or excrement of a patient, where we want to keep those two separate, but we're working on the same area. So you just want to make sure you don't go back and forth.
Yep, absolutely. No, I have that, and that's just absolutely critical. And it's a critical part that you guys really keep. And I know that, you guys keep a really good eye on also everyone else in the room to make sure that everyone maintains sterility. I know as a medical student, I've gotten snapped at a number of times by the surgical tech, like, you broke sterility. I'm like, so, yeah, so that's, I know it's super critical. From your perspective, like what is kind of your favorite part about the job?
My favorite part about the job is the surgery, the rapport that you have with the surgeon, knowing that there's times where the surgeon doesn't have to say a word and you are already handing them what they need. They know you know what you're doing. They're focusing on the surgery. You can keep talking. There's no, it's the rapport that you have in that relationship you build with your OR team, as far as your surgeon, your resident, your nurse, your anesthesia, and we're all there and we're all for the patient, but it doesn't feel like work. It feels like you're hanging out with your friends doing surgery, which is weird to say, but that's exactly how I describe it.
Yeah, I've definitely felt that before in the operating room. I mean, especially in some of your rooms, like where everyone's just chit-chatting during the
Yeah,
surgery and things are getting done, but everyone's having like a good time, and the time goes by pretty quickly.
yes.
What would be, in terms of something you're like, yeah, I could do without that. It's not my favorite part about the job.
Um, Definitely the call.
Mm.
I'm not a huge fan of call, but there are definitely facilities and establishments that have fewer call. I originally started in the main hospital doing cardiac cases, so I was doing open hearts. That is a lot of call. And obviously those cases come in midnight, 1 a.m., 2 a.m. And then there's facilities where we're at right now, which is outpatient or, less critical, and the call is very minimal. That is something that I'm not that fond of.
Yeah.
I'd rather be at work, get it done, don't call me back.
Hey,
Yeah.
as years have gone on, I feel the same way. I'm getting call. I would get rid of it completely if it was an option for me as well.
Yes.
And in terms of probably a lot of high school students are looking at this saying, yeah, maybe I'd be interested in doing that as a career. What would you advise them?
I would advise them to do it. I love what I do. I feel you feel the role you play is an important one. So you're never going to feel like you're just, for example, me, I was a secretary just sitting there answering phones. Anybody can answer a phone. I feel like the more pride you take in this job, the better you feel. I would definitely suggest to anybody use this as a stepping stone, which is something I regret not doing, into maybe advancing your career and, you know, becoming a nurse or becoming a PA or something else. Just get your foot in the door, see what it is you like, because there are a million types of surgeries. I am not a fan of sinus surgery. I cannot handle boogers. I can handle everything else, but just boogers I cannot do. So this would be a good opportunity for somebody who is maybe thinking to become a PA or a nurse practitioner. Like, you know, I really think I want to do plastics, and then they get there and then like, no, I want to do colorectal.
Right.
But I would use it. I would do it. I mean, the schooling is not long. The reward is great. You have a rapport with everybody who works there, and I would use it as a stepping stone for sure.
I think it is. I think it's good. It's a real opportunity. You know, you can go for 2 years. You come out with a skill that you can immediately
Mhm.
put to work, and then if you stop at that level, and I mean there is good money in what you do. So I mean
Oh,
that's
for
good.
sure.
But if you want to go on, you already have a career in place, and you can just continue to build upon that. I think that that's a really good opportunity in that sense. Are there a lot of schools in the country? Is it just would you just say just get on the internet and look up, you know, surgical technician schools and then give them a call?
Yeah, so I know there's a lot of schools in the country worldwide. Or like throughout the country. I think a lot of, depending on what state you're in, I know most of the programs are a lot less than what we pay here in California because they go through a junior college. So it's a 2-year associate's degree, as opposed to you go to a private technical school and that's all the degree you get is just a surgical tech. So definitely look into it if you have the time. Go the cheaper route and go junior college than a private school. You'll be making money a lot faster, and you will be able to use it to further your career if that's something you want to do.
Awesome. Karen, thank you so much for your time. I think the people
Thank
watching
you.
are really going to appreciate it.